currently pays about $60,000 a year to provide health benefits for board members. Do you support keeping this benefit? Why or why not?
Right. Well, I do support keeping the benefit. I know.
Sorry.
Thank you.
That was not an editorial comment.
I do support keeping the benefit. I know that Kevin's campaign has been based around getting rid of it. And I love the sentiment. I love the sentiment of wanting to contribute that back to the schools. But I think part of the board's mission is to create policies that are going to create a sustainable district and system that will help us in the long term. This year, I may very well have the opportunity to switch to a private plan that may be very similar to Kevin's situation. But if I decide to drop the health benefits of the district, I'm not going to tell anybody. I'm not going to grandstand about it. I'm not going to make a big issue about it because I think these things are divisive. And I really think that several years ago, for those of you who remember, there was a constant fight, public fight, between the various constituencies in the district. The staff, the teachers, the board, the administrators, and it was really difficult to go through at least once a year, sometimes more than that. And making these issues divisive, I think, does not help that in any way. We have come together, and today I think we're all working really well as a team. I think one of the big problems with making this public is I believe it attracts the wrong kind of people to the board. If people are just coming for benefits, are those the kind of people we want on the board? And there are some real benefits. I think it keeps us on par with all the similarly situated districts. It maintains a level of professionalism and motivates board members to spend the time that they need to spend to do the work that needs to be done. I'll end there.
Okay. Kevin, I'll go next to you. Question 3. The district currently pays about $60,000 a year to provide health benefits for board members. Do you support keeping this benefit? Why or why not?
Well, needless to say, I don't support it. Thayne characterized my campaign as being based on being against the school board benefits. It's actually, I think the campaign is based on much broader, I would hope, principles than that, but I'll just start with that. I think it's a good place to start. I think it's troubling, actually, to have a position that we should not make public the benefits that the board receives for fear that we might attract the wrong people. I think that's the mentality that people in the public think that administrators often have, that they can't be trusted with the facts regarding how the schools are being paid for. You know, we all live in, this is a small town, and there are teachers among us. Teachers are my friends. People in all aspects of the economy that is our public school system. I have never encountered a situation where people felt like they couldn't have a legit conversation on issues of benefits, be they for retired people, be they for the current school teachers, the certificated. So, you know, I looked at how this started, or at least in the bylaws it says that board members are entitled to either $250 per meeting or medical benefits. And these, again, are benefits not only for themselves, their families, their children. Those benefits, again, cost about $66,000 a year. That's how it's currently budgeted. Clearly, when this was started, when this benefit perk was started, it was not intended to be worth $15,000 or $13,000 a year. It was presumably, at some point, worth about $250 per meeting. So, you know, it's not my fault that these kinds of benefits became so expensive, but they're hugely expensive, and there are huge issues with our budget concerning these, and they have to do also with promises we've made to our certificated and classified employees as well, that hopefully I'll bring up later.
Thank you. Bill, I'll go next to you.
Wow. Well, first of all, in all candor, I had no idea there was such a benefit. the circumstances are such within the valley, and I've spoken about it before, and these folks have as well. We all are going to have to share some of the problem and some of the weight, some of the suffering that goes with it. If there were a way to take it step by step and break things out so that everyone shared some of the responsibility, some of the load in percentages, then I would think that that would be the first best way to go. But the total volume, amount of money we're talking about isn't so much that it could not be put aside. Here, my question would be, if the board decided, well, yes, let's eschew this amount of money pro tem, and that after things got a little bit more stable, it could be reinstituted. Perhaps that would be something to consider. But in any event, folks, I think it is something that has to be discussed, deliberated, but the board has to take some of the fair weight as well. It is, I think, the appropriate thing to do, at least in the public eye.
And Linda, I'll finish with you. Question number 3.
First of all, this is for 5 people. It's not, so it's important to understand that. Secondly, it's legal. This is, most school boards in the state get either an amount per meeting or health benefits. So we're not doing anything unusual. And then actually also, several of the school board members do contribute a percentage back to the district because, you know, an equivalent amount or more than the equivalent amount the teachers are suffering. So, you know, we don't talk about that, but we do that. I figured out I'm making about 21 cents an hour for the time that I spend on school board activities. I think I'm worth that.
I think there are a couple of issues. One, I think either I didn't communicate or it was mischaracterized. It's not my intention that any benefits to anybody not be made public. My concern is to grandstand about it and to make a huge public issue about it. I think those are two very, very different things. Secondly, as Linda pointed out, I think I'm kind of in a unique situation, having been involved with a lot of nonprofits, to see the quiet giving that board members do. And I think the implication being made that board members are takers is absolutely and completely wrong. And not for myself, but to stand up for the other members of the board who aren't here. And the money that they've donated, either, you know, quietly, anonymously, in other people's names, and to try to paint members of the board as being unfair is just wholly unfair. And I think we could save more money by all being healthy and bringing down the cost of the pool. And that's it.
And I'll use one of my ones.
Okay. One.
So I think anyone who knows me knows that I'm not in any way casting aspersions on people's character or suggesting somehow that the current board is being unfair or somehow, you know, money grubbing. However, I think this is a very real amount of money. You know, the board sits at an OEF function, and we're all very happy when OEF raises $20,000, and we're talking about $66,000. I don't care particularly how we got where we are. I just think it should stop. I think that money should go back into the school system, and I think we can get a board on our schools that will be able to serve without getting any benefits at all. I also think it will add to the credibility of the board, because it will allow the board to be in a position where we're getting nothing. And when we look at other benefits out there and we have to make these very difficult choices and say, I'm sorry, classified employees, you're going to have to take less. I know teachers, for example, who teach two-fifths. Sorry, I was looking at that fake green light there.
Well, that's for the team.
I know.